Today, I would like to talk about the importance of a first trimester ultrasound scan. The main goal of any fetal ultrasound scan is to provide accurate information so as to optimize the antenatal care for the best possible maternal and fetal outcomes. The main purpose of the fetal scan done during the first trimester is to assess the viability. That is, if the fetus is a live fetus or if it's a case of any miscarriage. The second thing would be to identify the number of fetuses present within the uterine cavity, whether it's a singleton pregnancy or if it's any multi-order pregnancy, like twins, triplets, or it could be even be a higher order pregnancy with such a steep increase in infertility treatments that the women are undergoing. The main purpose of this is actually to screen for Down syndrome, where certain parameters are assessed during the scan for the fetus. Like we look at the nuchal translucency, the presence of nasal bone. The heart would be assessed in an extremely great detail where we look for tricuspid regurgitation, ductus venosus. So these are all certain parameters that we look in the fetus during the ultrasound scan. And finally, added to this would be another biochemical or a blood test that the woman gets it done. We all know we call it as a double marker test. So both parameters from the ultrasound scan and then the biochemical parameter obtained from the blood test would be added up, and finally all these women get a risk stratification into either a low or a high risk category. The other major importance of the scan is to identify all the early major congenital anomalies that this fetus is having. Now, with the availability of this high frequency and best technology ultrasound machines, we have most of the, that is around 60% of the congenital anomalies can be identified at this early gestational age. All the fetal organs would be assessed like the brain, the heart, the spine, the extremities, and we would just comment in the scan report saying if that growth or normality is normal for that period of gestation or not. The other important thing that we would look for in the scan is to do a screening for preeclampsia, which is done in all the pregnant women who come to our clinic for an NT scan. Following this, we would greatly decrease a preventable cause for both maternal and fetal mortality and morbidity. Henceforth, a very good fetal first trimester ultrasound scan, which is preferably done during 11 to 13 weeks 6 days of gestation, should carry all the information regarding the fetal viability, the number of feti within the uterus, presence of normally developed organs for that period of gestation, or any other abnormality in the fetal organs should be looked upon. Down syndrome screening risk would be given and a preeclampsia risk stratification should be mentioned in the report. Do get a first trimester ultrasound scan done from a trained fetal medicine expert so that all of this information would be provided to get the best possible fetal and maternal outcomes. Thank you.